Okay, so you're rolling the patient in right now. You're by yourself, let's say, or you're with the preceptor and you really want to impress them. So when you bring the patient in, roll the bed up to the side here, to the bed, drop the railing, lock the bed where the head right here is matched up with your head, so you won't have to move the patient twice, okay? As soon as you're done, the bed's locked, the nurse is going to help get the patient over. You either are going to help if there's not enough people and make sure the stretcher doesn't move on this side, or if the nurse is on this side making sure the stretcher doesn't move as the patient's shifting their weight, you're going to go on the other side and just stand there to make sure the patient doesn't roll off the bed. If there's two people here doing that, then leave the bed. Let's be productive. Head right over to your machine. Your machine should be locked so no one can see your meds. Log in so that you have access to all your drugs. Everything should already be set up in the room. So you should have your airway prepared, right? You should have your machines already checked. I leave my monitor off, so I got to turn my monitor on. You can start your case, right? So look at this, guys. Start, but the flows have not started yet because you have to hit start again. So now I start again. Now I see positive flows. I can get these on all the way. You can go to 15, whatever you want to do. Make sure my pop-off is open. It's not comfortable when you have a closed or semi-closed pop-off as you breathe through it. Make sure that I'm on bag mode right here, right? Log into your Epic. So I log into Epic. I go to the patient's chart, and I click Start Anesthesia, Start Vital Signs, and in the room. So now it's all going to start recording as soon as we're ready. Patient at this point is now moved over to bed. So you can ask yourself, well, some people are going to be picky and want you to have the vitals on before you give pre-meds. You do whatever you think's best. Pre-meds should be for people who are obviously anxious. They benefit from a little bit of anxiolytic like Versed. So give maybe 1 to 2 milligrams depending on the patient. Some might need more. And as you age, you might need a little bit less. So as far as putting vitals on, the next thing you want to do is you're recording on Epic. So you want to now start to hook up your vital signs. So O2 sat goes on, probably the finger with the IV. Blood pressure cuff goes on the opposite so that it doesn't interfere with your IV and it doesn't interfere with your O2 sat. Put your leads on, right? So my leads are already laid out with my stickers. So your brown lead's going to go V4 or V5, and then the rest will go as you normally would. I'm a big fan of using the mask straps. So what I'll do is I'll tell the patient after I hook them up, like, are you okay breathing some of my oxygen? You have no problem with the mask being on. And they'll probably say no, they're fine. So I lightly strap 2 of these straps on, and they actually hook right in. They hook right into these little clips right here. They loop right into there, and I just get this placed on their face so they're already pre-oxygenated. You're gonna look like a professional. Most people do not tolerate being flat if they can avoid it. So if we can find the clicker, I'll go up on the bed and sit their head up just slightly. And I don't think we're working. Okay, so actually what just happened was the bed was not locked. So I found what could have been a serious issue was the bed was not locked. Now the bed will go up. The bed will not move up or down unless it's locked. It's one way to know. So we're just putting the head of the bed up like 20 to 30 degrees so that they have less autolactasis, less VQ mismatching, especially as you age and stuff after 40, you start to have that when you're flat. So now they're pre-oxygenating, their vitals are on. I'm cycling my blood pressure every 2 minutes, sometimes 1 minute during the induction because it really tells you a lot about what's going on before it's been 5 minutes and now your pressures are in the 60s. My O2 flows are up all the way because then they're actually breathing oxygen and not just recirculating their own air. You can look and see on here what their tidal volumes are as they breathe spontaneously. It may not be anything because the mask isn't sealed really tightly, but when you do go to seal it and hold the mask on their face, then you can start to look at their tidal volumes and look at their end tidal CO2. So I'm pretty much ready now, right? My vitals are going. I have my airway ready. I might put my airway right here and then put my blade right here as well with the blade already out of the bag and ready to go. And then to look really good too, have your suction right under the bed here. And it honestly serves no more purpose having it, let me just use my other hand here, with it being here or there. But for some people that you're working with, Seeing it right at the head of the bed makes them feel more comfortable and lets them know that it's working. Versus when it's over there, they don't know if it's working. But now they can hear it, and you just look really prepared. And so now when someone comes in to start the case with you, you've got the patient already been pre-oxygenating for minutes. Your airways are ready to go right here. Your suction's right at your side. You got your monitors on. They're cycling appropriately. Your vital signs are running. Since you open your Pyxis, you've given a little bit of pre-medicine, if that's what you guys agreed to. You have all your other meds up here and ready to go, okay? So let's talk about meds then. So for meds,